Good day everyone, this is Taste Eat Healthy Living. Today we want to look into blood pressure in children. Blood pressure is more common in adults, but children may have it as well. In most cases, high blood pressure in children is not diagnosed on time. This is because it doesn't cause many symptoms in children, as is thought to be more of an adult health risk. But untreated high blood pressure may cause problems later in life for these kids. Because of this, it is better to know how and when to have a child's blood pressure measured. Let's look at how blood pressure measurement for children are different from those of adults. The method to measure blood pressure in a child is the same as for an adult. Doctors typically check the blood pressure of a child 3 years or older once a year. If high blood pressure exists, they may check it more often. If the high blood pressure is consistent, the ideal blood pressure number for children. There isn't a single blood pressure reading that is ideal for children. The correct blood pressure depends on the child's age, gender, and height. And so the ideal blood pressure depends on the average blood pressure of others in the group. If the child's blood pressure holds between the 90th to 95th percent, they have pre-hypertension. Doctors will diagnose the child with high blood pressure if their blood pressure is above the 95th percent. Once in their teens, the ideal blood pressure readings for a child becomes the same as that of an adult. Causes of high blood pressure in children. High blood pressure in children can be of two types: primary hypertension and secondary hypertension. There is also a third type called white coat hypertension. This is when a child's blood pressure is high only at the doctor's visit, but at other times, the reading are normal. This is typically caused by anxiety during the doctor's visit. Now let's look at what cause primary and secondary blood pressure in children. Primary hypertension is when there isn't another underlying medical conditions for high blood pressure. Yes, there must be something that's causing the child's blood pressure to rise. Most doctors consider the cause to be genetic. Many children who developed high blood pressure seem to have family member who also deal with the same condition. Another reason behind primary hypertension is obesity. Many times, obesity can also have a family history. Other times it is almost due to lifestyle factors. However, secondary hypertension is more common in younger children below the age of 6. This is when high blood pressure is caused by some other medical conditions. Kidney disease is one of such conditions. Some children with high blood pressure also have abnormal blood vessels. Another cause is endocrinological disorder. This means that there can be issues with major hormonal glands such as thyroid or the adrenals. A small percentage of children also have some kind of heart disease, and this causes secondary hypertension as well. Symptoms of high blood pressure in children. Most children don't experience any symptoms of high blood pressure. As blood pressure goes higher and is undetected, the child may begin to have some symptoms. This include headache, vision problems, chest pain, breathing difficulties, abdominal pain and dizziness. And that is why it is important to monitor a child's blood pressure at least once a year. Most doctors recommend lifestyle changes. This means eating a healthy diet. The diet should include whole grain, nuts and seeds, fruit and vegetables, and low-fat dairy. It should also exclude processed foods as much as possible. This is because processed foods contain excess salt, and this salt can further raise blood pressure. Lifestyle changes also include regular exercise. Most children have an underlying condition that raises their blood pressure, but for some, it may be an effect of genes and obesity. Many children with high blood pressure go on to have high blood pressure as adults. But this can be prevented through lifestyle changes. That is why early screening and detection of high blood pressure is necessary. An overall healthy lifestyle can prevent lifelong medication for children with high blood pressure. So if a child is diagnosed with high blood pressure, the parent should make room for improving their lifestyle. This includes eating a healthy diet and exercising as a family. Treating the underlying cause may also reduce blood pressure. The goal is always to have the child not grow up to have lifelong high blood pressure. In summary, the number one way to lower your blood pressure is to eat healthy. Thanks. Please follow our page for more information on how to live a healthy lifestyle. Remember, it is better done while you are not sick than to start when you are sick.